My name's Beth Newstead and I'm one of the consultants working here at the emergency department at Derriford. So as most of you will be aware, we've seen a big increase in the number of COVID cases over the last couple of months, and we really don't know how much worse that's going to get with the new variant now on the scene. We can reassure you that here at Derriford, through every step of the pathway, we will try and keep COVID positive patients separate from those without COVID. But that does put an extra strain on an already very stressed system. By separating these patients out, we have to have different wards and different areas of the emergency department dedicated to looking after both groups of those patients. So this can increase the waiting times for a bed in the hospital, because we need to get the right bed for the right patient, and obviously that has repercussions for us in the emergency department, as patients often stay with us for a very long time whilst waiting for an appropriate bed to be seen. So when you turn up at the emergency department, we will aim to get one of our nurses to see you as quickly as possible, and the nurse will do what we call a triage assessment, and this is to sort the patients into a priority order. As always, for the most critically unwell and injured patients, we want to see them immediately, as soon after arrival as possible. But for those with less urgent conditions, then we deem that they may be able to wait for a period of time. And we have a set of categories for patients from 1 to 5, depending on urgency. If you're in one of those lesser categories, then you may, I'm afraid, have a very long time to wait to be seen. So we do recognise that patients are often waiting a lot longer than we would want them to, and we apologise for that. However, I just have a plea that if patients could try and be patient, I can assure you that behind the scenes all our staff are working absolutely flat out. We are often short-staffed because our staff have also been affected by COVID, so we are doing absolutely everything we can to see patients as quickly as possible. So please be patient. By all means, ask for information if required, but do come with the expectation that if your condition is less serious, then there may be a very substantial wait. So one of my key messages is that we are open for business as normal at the emergency department, but we need to try and ensure that we are reserving the emergency department for those that are the most seriously unwell and injured. So examples of that would be patients with significant chest pain, patients with acute onset of shortness of breath, patients with signs and symptoms of a stroke, any severe bleeding that can't be stopped with simple first aid measures, and clearly significant injuries that can't be handled through a primary care or a minor injuries unit. And just a reminder that there are all sorts of different sources of help for your medical condition. Please do think about whether it might be best managed by your usual doctor. The local GPs are very much open for business as usual and are seeing patients face to face. A pharmacist may also be a good point of contact. Minor injuries units are very good at dealing with minor injury and illness, and you can always phone NHS 111 if you're not sure about your next steps.